NYU first came to Grenada in 2009 on the invitation of the Ministry of Health. We were exploring what type of outreach program we could do for Grenada. The Minister of Health at that time, Mrs. Ann Peters, challenged us to think bigger.
She said, I'd like you to take care of 26,000 children.
We talked about designing something that has local sustainability that can actually change the disease states of large populations.
It was designed to prevent the problem in the first place, to be a preventive oral health program.
Toothbrushing 2 minutes in the morning with fluoridated toothpaste, fluoride varnish 3 or 4 times a year, and sealing the first permanent molars.
There are about 12 dentists on the island. We find that dentistry has not been one of the disciplines that has been promoted on a large scale.
A dentist was always for extraction, never like preserving a tooth or anything. Extraction.
The children are typically eating a lot more candy.
Good snacks or bad snacks? Is it sugar?
Yeah. Too much sweet will surely rotten your teeth. So children, be careful what you eat.
Some of the parents can't afford to buy them a toothbrush and toothpaste. On our first survey, we found that a lot of those children didn't brush, or they told us that they shared a toothbrush with their mom and their 3 siblings.
Healthcare is a very expensive issue for us. We want people to be more proactive. We want people to take preventative measures.
We came down here in January 2010 with a team of people, and we conducted the tooth decay study, the actual counting of how many cavities we had.
There was an 83% caries rate, and that's huge for this region. It's huge for anywhere, really.
When it was first introduced, the dentistry program in our school, it was an exciting time for our children.
Was pleased to provide toothpaste, toothbrushes, Prevident varnish, educational materials, and support for the implementation of this initiative.
To have dentists coming in school and you having a toothbrush and your own toothpaste, I mean, it's a wonder.
We teamed up with the local dental team.
Dental auxiliaries basically go out in schools to apply fluoride varnish and to do sealants.
All of a sudden you start doing it and the kids brush in school.
We're back in Grenada to do a final survey, very similar to the survey that we completed 3 years ago. And the whole plan is to see if what we have done over the course of the past 3 years, coming here every 3 months, has really made a change.
We work in the school, so we're working against the school hours. We have from 8 a.m. to 2:30 to see as many children in as many parishes as possible. We're actually finishing dental exams today on the 6, 7, and 8-year-olds.
Hello, miss. How many years do you have? How many times do you brush every day?
now we're just going to count your teeth, okay?
With the quantitative data that we're doing, we're basically looking in the children's mouths and we're seeing of all of the surfaces and all of the teeth, how many are healthy, how many are the way that they're supposed to be.
We are ready to count the teeth. We have number 3, A, B, C, D, 8, 9.
And that kind of gives us information that we can compare to the first round of exams.
While we can look at the numbers and measure the disease that way, the qualitative evaluation is something that adds a richer context.
A qualitative study looks at information from interviews and focus groups and surveys. What's going on? How is it working? What are the views? Have they changed? What they know about the program, what they know about oral health, and what they would like to see changed, and what is working and what isn't working.
So then you're going to flip to the beginning. And the ones that say OP are the opinions, so everything in this table is opinions. We're really looking for them to give us their experiences and their opinions so that we can design a sustainability plan that's realistic and that will be accepted by the people who are affected the most by this.
We had to figure out, how do you make it sustainable?
The schools are the main vector.
If the principal is really gung-ho about this project, and most of them are, then that trickles down to the teachers and they realize the importance, and then that trickles down to the students, which then goes to the parents.
And the more people that start signing on, the bigger it snowballs until everybody's really interested in doing it.
There's been a change, and it'll be exciting to see exactly how great of a change, both with the qualitative data and the quantitative data.
We had finally finished about 3 years of work, and now we had data that was going to show what we did and the effects of what we did. The original goal that we had was that the new decay would be decreased by 50%.
The 6, 7, and 8-year-olds have new teeth erupt that had been continuously maintained while they were under our brushing and fluoride program. We see a decay rate that had 1.8 surfaces of decay per child in that same age range in 2010. Today, we see just about 0.15, 16, which is a 90% reduction in tooth decay.
With the qualitative analysis, we learned a lot of information on what worked, what didn't work, what they were aware of, what they weren't aware of.
Parents and teachers had a higher opinion of the importance of oral health when they had higher exposure to the program. By and far, people recognize that there's a large problem with children eating a lot of sweets. When you have 90% of kids eating sweets every single day, most of them 2 times a day or more, that's part of the problem. Over 80% of the teachers told us on the questionnaires that the fluoride varnish doesn't take up too much class time. It's not that big of a deal. They felt it was important for this to be happening in schools and that health education is a part of their job as a teacher. So this was encouraging when we look to the future and when we look to how this program will be sustained, that the teachers are willing to take an active role in continuing these elements that we've started in the schools.
And the basis behind all of these components is sustainability.
The key informants and focus group participants mentioned some very specific areas: manpower, resources, leadership and program organization.
We put all of these components together so that we came up with an integrated report that we're presenting to the government in Grenada.
If we fail to sustain the program, knowing full well that if children are left to reach adults and have serious dental problem, it would cost the country more.
The Grenada project demonstrates that collaboration with key stakeholders, government, academia, industry, and others is critical to address the problem.
This will take a government having the same commitment to their people for a long period of time to actually realize a generation of children without cavities.
The Grenada program has been 3.5, 4 years of incredibly hard work by hundreds of people.
Improving the health of 26,000 children is dramatic, and we're ready for more.